we get right back into our conversation on maternal mental health. Thanks for watching.
I would never say to my child, we end up replicating those things. So we have to be intentional and proactive in making those changes so that we're not, especially when it comes to an intergenerational trauma, we're not passing those traumas down to our own children. So making intentional changes. So I think about like a mother who experienced sexual assault or violence in her family. So it's her way of coping with that. And if she's coming from a family where you don't talk about those things outside of the family, this mom's way of coping is, my children cannot socialize with anyone. So now my kids aren't really developing those social skills. And we're not going to talk about these things because they're not talked about. So that becomes the norm in the family, not to talk about abuse or assault when it comes up. So it's still being held within the family. And then say that mother's daughter then does become interested in boys. As the response, the mother is very punitive, angry, hurtful towards the daughter because she has this interest in boys. So the mother's trauma, her trigger response, she wants to protect her child, but the way she's protecting her child because she hasn't done her work is actually ends up being hurtful and can create an environment where her daughter could be more likely to be abused because she's not learning to advocate for herself. She's not learning what's right or wrong. She's not learning how to, if someone does hurt me, these are the things that I do. So it just perpetuates these things happening through the generations. So when we're trying to make those changes, especially when we're trying to break those intergenerational traumas, we have to be very intentional with it. And we have to make sure that we're healing so that our generations, our legacy after us are going to be in that healing environment to best protect them and to support them and having a different experience that we had.
Oh, yes. But it's very, it is specific. Like, you have to do the work. Being that, no, you can't just say, I don't want to be like that. Mm-hmm. How do you want to be? And be very intentional about doing that. Mm-hmm. That's good advice. Thank you. Can you talk to what? Now I see this question here. It is transition to motherhood and also sandwich generation. What exactly did you mean by? You mean like with your parent and your children and dealing with that, or?
Mm-hmm. Mm-hmm. Yeah, so just in general, this transition to motherhood can look very different. And again, we want to have a wide range of what is considered normal in that transition. Our transition to motherhood can happen when we are 18. Our transition to motherhood could happen when we are 40. There's going to be a different experience, yet it's still going to be a transition. So what does that mean as we're navigating through this transition? Thinking about women who have their children when they are older in lives, maybe have a more established career, likely their identity has been well established. So then transitioning to sharing your life and having known your career, having known your body for so long, what does that look like? And then what happens then after when our transition is, okay, after 3 months, I'm ready to get back to work. So what does that mean for me as a mom that I'm ready to get back to work? Or actually, I don't really care about working so much anymore. My focus is more in being a mother. How do I navigate through that transition of, for 38 years, I've known myself to be this way. And now those degrees, those diplomas, those accolades feel less important to me. What I really want to do is focus on raising my child. It can create an identity crisis or identity concerns for women. So being able to navigate through that transition wherever we are in the stages of our lives. And with Black women specifically, not only Black women, but with Black women who are oftentimes being placed in this more maternal role and this care taker role, that they can find themselves in that sandwich generation of they're taking care of their children, and then they also would be taking care of parents or elderly people in their lives. So many different developmental needs, and women having to wear many different hats of taking care of young children, taking care of parents, and not really feeling like then they have time to take care of themselves. So that transition, as my parents are aging and I'm trying to bring up my children, how do I balance all that? And in that balance, also not lose myself.
That takes a lot of work. Do you do that? Like, it's ongoing, right? So that takes preparation while you're pregnant, before you're pregnant, and then readjusting those plans, because plans can change. Like you may have it all lined out. It's going to be like this. It's going to work like this. And then sometimes you have to change it, and then being adaptable. So adaptability as you go through this journey, I think it's huge, because like you said, if you feel like this is my identity, this is who I am, and then there may be that, I know I certainly experienced that conflict of, is that all I am now? Like, am I only a mom? Like, what about the rest of me? And finding that balance, and maintaining it.
Yeah. So not wanting our identities to get lost, but then also being able to normalize that if our identity changes to my primary identity right now is focused on being a parent, that's okay too. That in two parent homes, if a parent is staying home, they can feel this pressure of, or this idea that their work is not as valued or it's not as important as the other person's work because they're not financially bringing in money. And I think that just speaks to how we're not actually valuing the work that comes into maintaining a household and raising children. So even that, we will want to shift away from this idea of I'm just a parent. That is a huge responsibility in being a parent and raising children. Financially, even if we were paid minimum wage, we would be making probably more money than our spouse is, who might be working, or who our partner is, or our other support person is, who is working outside of the home. So being able to even there shift that focus, that there's so many ways to be a parent, and all those ways are okay and need to be valued and appreciated.
Yes, because I'm not a baker. I think some people some people may get caught up in feeling like this is the way it's supposed to be. This is the way it's supposed to be, because based on these preconceived notions and societal norms of the narratives that get pushed through of this is what it looks like to be a parent, and this is what it's supposed to be. And so there's no one right way, as long as it works and you all are growing. I feel like if it works for you and yours, do what works for you and yours. Right? Because it could be even little things. Like, I know sometimes people are like, you don't need to have a binky or pacifiers, or just because people come with all these, there's so many influences from outside sources of what you should be, how you should be, and those pressures. And standing up in the face of that and embracing who you are and what you and your values and what you find important, and then what works for you too.
Yeah. So, and you can certainly chime on this more than I can with you being a registered nurse, but there are certain things that are a no. Like, do not abuse your children. No. Do not take that baby.
That's a hard stop.
And then there's like even some variation of, looking at marijuana use right now while pregnant. There's a lot more research that's coming out around that.
In that, because please continue, because I would like to talk to you about that too.
But in general, do not use drugs while you are
no safe amount
child and while you're nursing. So there's some hard no's or things that we don't want to do. But then outside of that, there's just so much gray area of what is okay and is healthy, and not to feel overwhelmed or that we're doing something wrong. I know when I was pregnant, I was reading blogs, and at 6 weeks, my child is sleeping 12 hours through the How is your child at 6 weeks sleeping 12 hours throughout the night? Just okay, and wonderful that works for you, right. But my children are not sleeping 12 hours. So I'm not going to feel bad about myself because that's just not what my children are doing. And I don't know how you're doing that with them. More power to you. But that's okay that my child at 6 weeks is not sleeping 12 hours throughout the day. But there's so many ways to bring up healthy humans. So just figure out what works for us, what works for our bodies, what works for our family, what works for our child. And then we want to find people to support us around that too.
Yeah. We continue in part 3 with choosing culturally competent healthcare providers and self-advocacy tips.